हेलो दोस्तों, मैं हूं स्मिता कुमार और आप देख रहे हैं आपका अपना हेल्थ चैनल मेडिसर्कल। आजकल हम अक्सर हाइपरटेंशन के बारे में सुनते हैं। ऐसा इसलिए है क्योंकि हाइपरटेंशन हमारी सोसाइटी में काफ़ी प्रेवलेंट होता जा रहा है। सीनियर वृद्धों में और सीनियर सिटीजन्स में देखी जाने वाली ये बीमारी आजकल यूथ यानी यंग जनरेशन में भी काफ़ी देखी जा रही है। आंकड़ों के हिसाब से करीब 33% अर्बन और 25% रूरल इंडियंस हाइपरटेंशन से ग्रसित है, जिसमें से 25% रूरल और 42% अर्बन पॉपुलेशन को ही पता है कि वे हाइपरटेंशन से ग्रसित है। यानी ऐसे बहुत सारे लोग हैं जिन्हें ये पता ही नहीं कि उन्हें हाइपरटेंशन है। इनमें से करीब सिर्फ 1/4 पॉपुलेशन का ही ट्रीटमेंट चल रहा है। एक और स्टडी में जहां 15 से 49 ईयर्स की आयु के करीब 7,31,864 यानी 7,31,864 लोगों का सर्वे किया गया। उसमें यह देखा गया कि करीब 18.1% लोगों में ही हाइपरटेंशन है, जिसमें से करीब 76.1% ने कभी अपना बीपी मेजर किया था और केवल 44.7% को उनके डायग्नोसिस के बारे में पता था। इनमें से करीब 13.3% ही लोग ऐसे हैं जिनको ट्रीट किया गया है और कुछ 7.9% लोग ऐसे हैं जिन्होंने इस कंडीशन पर कंट्रोल पा लिया है। हाइपरटेंशन को डिटेक्ट करना और भी ज़रूरी हो जाता है क्योंकि हाइपरटेंशन के कोई सिम्टम्स नहीं होते हैं और साथ ही साथ चूंकि इसका कोई क्योर भी नहीं है, इससे आप सिर्फ दवाइयों यानी मेडिसिन के जरिए और साथ ही साथ लाइफस्टाइल मॉडिफिकेशंस यानी जीवन जीने के जो तरीके हैं उसमें बदलाव ला करके आप उस पर कंट्रोल पा सकते हैं, उसे कंट्रोल में रख सकते हैं। हाइपरटेंशन बहुत बार जानलेवा भी हो सकता है क्योंकि ये कई सारे हार्ट प्रॉब्लम्स यानी दिल की बीमारियों का भी कारण होता है। इस तरह से हमें हाइपरटेंशन के बारे में जानना और भी ज़रूरी हो जाता है। आजकल की स्ट्रेसफुल लाइफ में हाइपरटेंशन बहुत ही कॉमन हो गया है यंग जनरेशन में। तो वो क्या चीज़ें हैं जिनके बारे में हमें ख्याल रखना चाहिए, वो क्या चीज़ें हैं जो हमारे लिए अलार्मिंग होनी चाहिए, जो हमें ये बताए कि शायद हम हाइपरटेंसिव हो रहे हैं, और अगर हम हाइपरटेंसिव हैं तो किस तरह से हमें उस पर कंट्रोल करना चाहिए, डॉक्टर की सलाह कब लेनी चाहिए और साथ ही साथ कब अपने बीपी को मेजर करना चाहिए, कंट्रोल करना चाहिए, ताकि हम एक हेल्दी लाइफस्टाइल जी सकें। मेडिसर्कल आपके पास लाता है राइट इन्फॉर्मेशन सीधे डॉक्टर्स, एक्सपीरियंस डॉक्टर्स और एक्सपर्ट्स की जुबानी। तो आइए डॉक्टर्स से ही जानते हैं कि हाइपरटेंशन क्या है, उससे जुड़ी हुई प्रॉब्लम्स क्या है और किस तरह से हम हाइपरटेंशन पे कंट्रोल पा सकते हैं। Stay healthy, stay tuned to Medicircle.
Hypertension is a condition in which blood pressure in the arteries is persistently elevated. High BP is also a major risk factor for stroke, heart diseases. Lifestyle changes and medications can lower the blood pressure and risk of health conditions. At Medicircle, we're presenting World Hypertension Day Awareness Series, wherein we're featuring eminent cardiologists to create awareness amongst general population about their preventive action. Hi, this is Sana Khan, and today in this initiative, we're going to speak to Dr. Ripen Gupta. Dr. Ripen is an interventional cardiologist and director at Max Smart Super Speciality Hospital in New Delhi. He's an esteemed and award-winning cardiologist in India who has over 28 years of experience in performing complex angioplasty and stenting, pacemaker and device implantations. He has several awards and recognitions to his name. Hi, Dr. Ripen. Welcome to Medicircle. How are you?
Thank you. Thank you for the nice introduction. Basically, I think World Hypertension Day is a very important day because 1 in 4 Indians are having high blood pressure. So I think we should.
True. We need to create awareness for this, right?
Yeah, this is very important because hypertension is easily missed. Heart attacks and all are not missed. We have a lot of symptoms. Patient land in emergencies, but high blood pressure we tend to ignore. So I think we should know the magnitude of the problem and we should know how to assess, because diagnosing hypertension is very easy. Correct. But I think managing is very difficult. We don't understand the complications of hypertension. I think that is very important.
True. Okay, so let's begin. And to begin with, what causes high BP?
You see, in majority of the patient, there is no reason for blood pressure, no exact cause for blood pressure. In fact, we have labeled it as essential hypertension. So a lot of my patients and patients who have hypertension, when they will go to a doctor, they will get a prescription of essential hypertension. Essential hypertension means that there is no exact cause. Though there are a number of factors which can lead to hypertension. Let's say there is someone in the family who is having hypertension, like your father, mother, brother, sisters, then your chance of having hypertension becomes more. As you become older, your chances of having hypertension becomes more. Males as compared to females have more chance of having high blood pressure, especially at a younger age group. Once you are 55, then the risk becomes same. Also, if we lead a unhealthy lifestyle, we don't do regular exercise, we don't eat proper food, we take more salt in the diet, that can lead to high blood pressure. Stress can lead to high blood pressure. In fact, diabetes in a reverse way can also lead to high blood pressure. So these are all factors. In fact, certain medicines also, like very commonly we give birth control pills in females. So they can lead to high blood pressure. So that is one thing. There is a common thing which take with acidity known as ENO. Now ENO can cause blood pressure because it contains a lot of sodium.
Oh, is it?
Yeah. So
it's a very common thing that people use when they're feeling any acidic situation.
Yeah. So when we talk of high blood pressure, we say sodium content has to be reduced. So if we take more sodium, sodium can be in salt also, it can be other things also which contain sodium. So these simple things can also lead to high blood pressure. In around 5% of the cases, there is a definite reason for blood pressure. And most commonly, it is kidneys in those patients. Either the kidney is not working properly or the flow to the kidney has been blocked. So like we can have blockage in the heart arteries. We can have blockage in the arteries which supply blood to the kidneys. And in few cases, there can be some tumors or abnormality of a gland known as adrenal gland. This gland sits on the top of kidney. And if it is not functioning properly, this can also lead to high blood pressure. These are the common reasons. Even if your thyroid is not controlled, that can also, if you're hypothyroid or even hyperthyroid, both can cause disturbance in the blood pressure. So these are various factors. But more important factor we have to remember is that majority will be having no exact cause where we can cure the patient. So we have to manage blood pressure. So that is very important aspect. We have to understand that blood pressure cannot be cured. So I have patients who will coming in the OPD and they'll say, doc, we're giving you medicine for 3 months. And after that, I'm okay. Now I don't need to take medicines. So I explain to them that once we start you on medication, most likely you will be on medicines for life. Though we don't start medicine in the beginning, we first give lifestyle management, but then because we don't have a cause for the blood pressure.
Correct.
We have risk factors, but we don't have a cause. So this thing again should be understood by the patients. If someone in the family is having high blood pressure, they should be aware that they are more at risk. So that thing it should be very clear.
So regular checkup must be very important in this case.
You see, blood pressure is a silent killer. So it doesn't cause any symptom. There is again a very, in the community, there is a lot of misconception that blood pressure causes headaches. If I am having headache only, then I have high blood pressure. A lot of time patient come to me with headache and the BP is normal, but they thought that I am having headache, so I must be having high BP.
Right.
So that thing should be clear that in 95% of the patients, there will be no symptoms. So everyone who is 25 years of and above of age should get a BP checkup done every 5 years. And if the BP is found to be on the higher side, then they should get it more frequently. And once it crosses a threshold of 140/90, then we'll advise lifestyle management followed by medications if required. So our cutoff for treatment is 140/90.
Right. So Dr. Ripin, what type of diet is helpful for controlling BP? Is there any diet that can control BP?
You see, there is a specific diet. They have given a name also. It is known as DASH diet.
Right.
DASH diet is specifically meant for patients to control blood pressure, and it has 4 or 5 components. One important component is that we should eat more of vegetables, more of fruits, and more of low-fat dairy, means skimmed milk or any paneer or anything made from skimmed milk. Cut down on the fats, cut down on the saturated fats, cut down on the trans fats, decrease cholesterol in the diet. And we should take more of fish, poultry, this we can have nuts, these are allowed, we can take more of that. And we should cut down on red meat, sugary drinks, sugars, because sugar, again, as I told you, in a reverse way, can lead to high blood pressure. So this diet, specifically the DASH diet, can lead to low blood pressure. And in fact, it is equivalent to 1 tablet of BP. So if you can follow this religiously, a patient requiring 1 tablet of blood pressure can do only with lifestyle management.
Okay.
Along with that, we have to limit the salt intake also. You see, normal Indians take around 10 to 12 grams salt, and what is recommended is 4 to 5 grams salt.
Oh.
So what we suggest in a hypertensive patient is to take around 2.5 gram of salt, which is something like 1 teaspoon of salt in 24 hours. So, which I tell to my patient in a easy way to remember is that salt should only be in your dal and sabzi.
Correct.
So no salt in your chapati, no salt in your rice, and no namkeens, no salt, no pickles, no papads, and all those things.
I think that's an additional that our people usually make a thali of. Our thali consists of all the dal, chawal, sabzi, roti, and then additional things that has in quantity of salt in it, like the pickle and the papad and everything.
You see, you have to understand why it happened. You see, we are living in a tropical country, and before these ACs and all came in, we used to sweat a lot, and along with sweat, we used to lose a lot of salt. So our ancestors used to take the salt as a defense mechanism. Now this is causing a problem because we are now living in an AC environment. We are not going out that much, so we don't sweat that much. We don't lose that much salt, and this salt is not troubling. But our palate is now become like taking more salt. So we have to change our diet, because if we don't do it, then India is going to be the hypertension capital of the world. Right now, if we have 140 crore people, and you can imagine that we have maybe 40 to 50 crore people who are hypertensive. I think no other disease is that prevalent in India.
Correct.
So clearly, this is a major issue. And as you rightly said in the beginning, that if blood pressure is the main cause of strokes, major cause of heart failure, and one of the major causes of heart attacks. So if we control this, we can control all these things.
Now, as we're talking about the causes, what are the side effects of BP drugs? That the medicines are given, and the people usually are very reluctant about using their medicines. They feel that ek medicine skip kar denge to kya hi ho jayega. It's okay one time I take it regularly, but 1 day, 2 days okay. So what do you suggest in that case?
You see, number one, we have to understand that blood pressure medications, we don't start in each and every patient. We first give a lifestyle management trial of 2 months in patients with mild hypertension. In severe hypertension, we have to give medication anyway. All the BP medicines are meant to be taken for life, number one. They have been studied for a number of years. The medicines which we have right now, the group of medicines have been there for 20 years, 25 years. So they are all maybe newer versions of that medicine come in, but the same group has been with us for so many years. So most of the BP medications will have no serious side effects. That is number one, we have to understand. Secondly, the medicines, we follow a philosophy of giving a combination of 2 medicines rather than a higher dose of 1 medicine. The concept is that if you give a smaller dose of 2 medicines, the side effects are minimized and the benefit is magnified. So clearly, if somebody who's hearing and he is a hypertensive patient, he will know that if the doctor has given a combination of tablet, small dose of one, small dose of another, coming as a single pill. So that will reduce the side effects also. Having said that, few patients may have some side effects, like diuretics can cause low sodium. If we give a calcium channel blocker, it can cause a little bit swelling in the feet. If we give a ARB or angiotensin receptor blockers, they can, in a patient whose kidney is not working properly, can cause a further change in the creatinine levels. So these are all small things which the doctor who's giving the medication is very careful, number one. And when you go for follow-up, he will ask you also, or he will do some blood test to see whether the medication is suiting you or not. If a particular medicine is not suiting you, he will change to some other medicines. So BP medicines, according to me, are safe, meant to be taken for your lifetime, not for 1 year, 6 months. Secondly, you asked a very important question, that can we skip a dose? You see, the guideline says that BP medications, we can give plus minus half an hour. Means, let's say I am taking a BP medication in the morning around 9 a.m. Next day I can take by 8:30, that is half an hour before, or by 9:30. So that is a window I have. We cannot go beyond this, because what happens is that the BP medicines have a half-life. So by the time, if you delay the medication effect will go away and the BP will start rising. And what we have seen is that if you are erratic in your BP medication, the chances of stroke becomes high. Because if the BP is controlled and suddenly BP becomes very high. This BP high can cause a rupture of blood vessel in the brain, and rupture can cause a stroke. So we have to keep the BP constantly in check. So this skipping of medicine is very wrong. A lot of my patients will say, Doc, मैंने 3 दिन दवाई नहीं ली, my BP has been fairly okay. I think I don't require the medications. What happens is that once you are on medication for many years, even if you skip for 2-3 days, BP may not rise. That doesn't mean you don't require the medications, because if a normal person takes these medicines, his BP will drop very low. So if you are having a normal BP on medication, that means it is the medicines which are bringing the BP to normal limit, not otherwise. So these few things we should be very, very clear.
And Dr. COVID-19 and hypertension, what are the links and risks?
You see, last year when COVID came in, there was a lot of controversy. There are a group of BP medication known as ACE inhibitors. And it was thought that the ACE receptor is the one which is an entry point for COVID-19 into the body. Right. So they said if you are giving ACE inhibitors, the ACE receptors are anyway very large in number on the cells. They get magnified because of ACE inhibitors, and that can lead to problems. But then it was seen that this is not the case. So recent guidelines from American College of Cardiology, European Society of Cardiology, and Indian Hypertension Society is that if a person is on hypertensive medications and in this COVID pandemic, he should not change his medicine, number one. He should, in fact, keep a very tight control also in blood pressure, because it has been seen that in COVID-19, if your blood pressure is not controlled, your chances of having complication from COVID-19 is more. So let's say a person will not be at more risk to develop a COVID-19 infection. And if he's high blood pressure patient and he has not controlled the BP well, he will have more complication. He may end up in ICU. He will require a ventilator. So that thing is very, very clear that in COVID-19, you should continue with your BP medicines. Even if you are not able to meet the doctor, you should continue medications. If you have doubt, you can touch base with him with a teleconsult, which is not a new facility available, which was not there before COVID-19. But do not stop your medicines. Keep your medicine under BP under check to prevent complication from COVID-19.
Thank you so much, Dr. Ripen, for coming to our show and sharing your valuable time and insights with us and our viewers today. It has been a pleasure having you on the show.
Thank you. Thank you.
Thank you so much. Take care.